Today we are going to talk about section 2 of module 1 on diabetes. Now in this section we are going to talk about the definition of diabetes, causes of diabetes, and under the causes of diabetes we will discuss about a very important topic, that is insulin resistance. Then we will talk about classification of diabetes, pathogenesis of diabetes and different types of diabetes. Now let us understand the definition of diabetes as per WHO. The term diabetes mellitus is described as metabolic disorder characterized by chronic hyperglycemia with a disturbance of carbohydrate, fat and protein metabolism resulting from either defect in insulin secretion or insulin action. Now let us understand few terminology that has been mentioned in this definition. Metabolic disorder is very important terminology that we need to understand very carefully. Before we understand metabolic disorder, we have to understand what is metabolism. Metabolism is a process in our body that uses to get or to make energy from the food that we eat. And metabolic disorder means it occurs when normal chemical reaction that is going on in our body is get disrupted. When this happens, we might have too much of some substances or too little of other ones that we normally need to stay healthy. Now, next very important terminology is chronic hyperglycemia. And chronic hyperglycemia, this terminology means chronic means long standing, hyper means high, glycemia means glucose level. Now next terminology is insulin secretion and insulin action. These we need to understand. Insulin secretion means body's ability or the beta cell's ability to secrete insulin gets reduced. Or sometimes although beta cell produce insulin, this insulin cannot act on the cell in the proper way. That we will discuss at length in next few slides. Now let us understand what are the different causes of diabetes. First and foremost one is pancreas may not produce enough insulin, and that is what is known as insulin deficiency. Second reason is cell does not use insulin properly. Beta cells, although beta cells are producing insulin, but cells are not in a position to use these insulins properly. The insulin can't fully unlock the cell to allow the glucose to enter inside the cells, and that is called as insulin resistance. So let us understand these two causes one by one. The first one is insulin deficiency. In insulin deficiency, what happens is this can result because of the autoimmune destruction of the insulin producing beta cells in the pancreas, and the subsequent lack of insulin can lead to increase in the blood and urine glucose. A decrease in the number of functional insulin producing beta cells also can lead to insulin deficiency. Also can be intrinsic defect in the secretory mechanism of the beta cell. Now let us understand what is insulin resistance. Before we understand what is insulin resistance, let us see what happens in case of normal individual. A normal individual, as you can see in this picture, this is glucose which is present in the blood, and normal individual, this glucose which is present in the blood can easily enter into the cells. However, in insulin resistance cases, what happens is the glucose which is present in the blood cannot easily enter inside the cells. So in simpler words, insulin resistance is a physiological condition in which cell fail to respond to the normal action of insulin. The body produces insulin, but the cell in the body become resistant to insulin and are unable to use it as effectively, leading to hyperglycemia. Beta cells of the pancreas subsequently increases their production of insulin, further contributing to hyperinsulinemia. In short, insulin resistance means normal response to insulin does not occur, or inability of the insulin to put the glucose inside the cell. Now let us understand various mechanisms of insulin resistance. Now first and foremost one is pre-receptor effect. And pre-receptor, there are, what happens is abnormal insulin gets released, and when the insulin is abnormal, it cannot go and bind with the insulin receptor properly. Second one is anti-insulin antibodies. Body's immune cell or WBC produce antibodies which goes and destroy the insulin. Second mechanism of insulin resistance is via receptors directly. Many a times what happens is the total number of insulin receptor decreases, and thereby insulin find it difficult to find out the receptor and bind and stimulate those receptors. Third reason could be insulin receptor blocking antibodies. Sometimes body produce antibody, the WBC produce antibody which block the insulin receptor, and thereby insulin cannot come and bind with the insulin receptor, and thereby it cannot stimulate the insulin receptor. The next mechanism is post receptor. In post receptor, this is very important. Although insulin is good, number of receptors are good, what happens is, although insulin come and bind with the receptor, there is a defect in the signal transmission. Thereby, although receptors are stimulated, it cannot send the signal inside. Next point is reduction in the glucose production. So total number of glucose transporter level decreases, or sometimes although glucose transporters are present inside the cell, they won't translocate towards the cell membrane, and thereby it cannot take up the glucose efficiently. Now let us understand various classifications of diabetes. In general, if you see, diabetes can be classified into primary and gestational diabetes, and these are the two diabetes which is very common. Primary diabetes can further divided into type 1 and type 2. Now let us understand first what is primary diabetes, and then we'll try to understand what is gestational diabetes. Type 1 diabetes is also known as insulin dependent diabetes mellitus, which is insulin dependent, and 10 to 15% of the cases are type 1 diabetes. Type 2 diabetes is also known as non-insulin dependent diabetes mellitus, and 80 to 85% of the cases are type 2 diabetes. Now let us understand the pathogenesis of type 1 diabetes, and then we will also understand the pathogenesis of type 2 diabetes. Now, as you know, environmental and viral infection can trigger our immune system. When the immune system gets triggered up, what happens is our body's immune system, immune cells, WBCs attack the islets of Langerhans cells or the beta cells, and thereby it causes inflammation of the islets of Langerhans cells. And because of this attack, what happens is beta cells gets destroyed. When the beta cells gets destroyed, what happens is there is a severe insulin deficiency, because as all the beta cells are destroyed, they cannot produce any insulin, and this leads to type 1 diabetes. In case of type 1 diabetes, the only treatment option that is available is insulin injection, as body failed to produce insulin. Now let us understand the pathogenesis of type 2 diabetes. In case of type 2 diabetes, two things can happen. Either the beta cell is defective, or it could be because of the genetic reason. Second reason could be either environment or obesity. So both these things can lead to either abnormal secretion of insulin or insulin resistance, and this lead to relative insulin deficiency. And because of the relative insulin deficiency, what happens? Beta cells has to work more, And over a period of time, when a patient has been diagnosed as diabetic, by that time in type 2 diabetic patient, 50% of the beta cells are already dead, and thereby what happens is beta cells has to, that 50% beta cell has to produce more and more insulin, and beta cell exhaustion happens, and this ultimately leads to type 2 diabetes. Now let us understand the difference between type 1 and type 2 diabetes. In type 1 diabetes, age is very less, it is less than 40. Onset of type 1 diabetes is for less than 40 years. Type 2 diabetes is more than 40 years. Type 1 diabetes, it can happen anytime, and duration, onset of type 1 diabetes is within weeks. But in case of type 2 diabetes, it takes months to years to develop type 2 diabetes. Ketonurias or ketone bodies formation is very common in type 1 diabetes, but in type 2 diabetes, this ketone body formation is very rare. In case of type 1 diabetes, it is insulin dependent, but in type 2 diabetes, it is insulin independent. Type 1 diabetes, normally we have seen autoantibodies gets formed and thereby destroy all the beta cells. But in case of type 2, there is no autoantibodies that gets produced. Most of the times, family history is absolutely missing in type 1 diabetes, but type 2 diabetes, as it is genetic, most of the times family history is very common. Type 1 diabetes, insulin level, body's ability to produce insulin is very low, but in type 2 it is either normal or sometimes high. Islet cells are inflamed, that is insulitis, but in type 2 diabetes it is normal or exhausted. Complications in case of type 1 diabetes, it is acute, and most of the times it is metabolic, and that is the reason ketonurias are very common. But in case of type 2 diabetes, complications are late and vascular. Vascular means related to blood vessel. In type 2 diabetes, more often it has been observed that blood vessels gets damaged. Thank you very much for your patience listening.